In this PowerPoint, we are going to physical examination and also care of the patient with eye disorder, care of the patient with ear disorder, and throat disorder. The first one, eye problems. When a patient comes to the outdoor or hospital, if we need to check their eye or any kind of eye disorder, first of all, inspection, palpation, vision testing procedure, and diagnostic test, we use the ophthalmoscope. By ophthalmoscope, it visualization of structure of the eye. When a patient is hospitalized, they come to you and complain about their problem. What did the patient say? It is called subjective data. And what we can see, we can smell, we can touch, we measure, it is objective data. Sometimes patient complain difficulty of vision, means decrease the visual acuity. So as a healthcare provider, when you check your patient's vision or visual acuity, we should use the Snell chart. Also, patient complain double vision, blurring, or blind spot. And also pain, redness, swelling, watery, or discharge from the eye. Use of glasses or contact lenses, medication drinks taken, or history of eye problem, like intraocular pressure increase, like glaucoma. So we need to check the pressure of eye, which is called tonometer test. What are the common subjective data? The external eye structure are inspected, include the eyebrow for symmetry, eyelash for every even distribution, eyelid for ptosis or dropping. Also, eyeball for exophthalmos means bulging outside or protrusion, or sunken eye. So in this picture, you can see eye is bulging outside. It is called exophthalmos. It is common in case of hyperthyroidism. Or patient can present with the eye drop, upper eyelid drop. It is called ptosis. It is very common in this one. I'm talking about this one. Very common in sunken dehydration. Upper eyelid falling, eye dropping. And this one is a sunken eye because of dehydration. And here we can see the normal anatomy of the eye, eyelid. The whitish portion is called sclera. So if you see white sclera is yellowish, means patient has a jaundice. This is the pupil. Pupil constrict and dilate because of light. And this one is called iris. This is the lens and ciliary bodies. So sometimes patient present structural inspected include conjunctiva. If the conjunctiva is infected, patient develop conjunctivitis. Sclera, it should be white. If sclera is yellowish, patient has a liver problem. Lacrimal apparatus, we would check for excessive tearing, redness, tenderness, or swelling. We check the cornea and lens. Should be smooth and clear. Also should check the iris and it would be flat, round, regular shape, or even coloration, eyelid and pupil. So we're talking about this, how it look like in case of a normal healthy person. Here the assessing and documentation of pupillary response. So first one is called light reflex. So in this picture, you can see the pencil light. When light is fall from periphery to center or from medial side to the center, how pupil constrict. So before to check, we make sure the room is dark. So darken the room and ask the client to look forward. So when the room is darkened, it is dilates the pupil. And when light fall, we test. And we test each eyes. Advance the light in front, the side to the side node constrict the same side pupil. So like this picture, when you fall the light from periphery to center, the pupil will be constricted. And sometimes stimulus constrict of the opposite eye. And accommodation. So ask the client to focus on a distant object. That times it would be dilate the pupil. And then ask the client to shift to the near object. I mean, how far, how near? At least 3 inches from the nose. Normal response include pupillary constriction and also convergence, axis of the eyes. But if a patient is dying, their pupil will not respond like this. It will be dilated permanently. Now, in this picture, again, I'm going to show you, this one is a center portion called pupil. And whitish is called sclera. So the eye here, eyes, objective data we said pupil are round and equal size. So both eyes, both pupil will be equal in size, both will be round. So increase the light causes the pupil constriction. Decrease the light causes the pupil dilation. So when you are in the dark room, our pupil dilated. But when we are in the bright light room, our pupil is constricted. Constriction of both pupil is a normal response to the direct light. So when we check left and right eyes, assessment of the eye, and we keep documentation of the pupillary response, a normal, healthy individual, the both pupil will be equal in size, both will be rounded and reactive the light. Means constrict because of light. Also, reactive to accommodation for the near or long sight vision. So easy way to remember: P for pupil, E for equal, R for round, and RL for reactive to light, and A for accommodation. Normal eye findings is PERRLA, Parla. So this is the chart, which is called Snell eye chart. So this is the Snell chart we use for examine the visual acuity, a sample tools to measure the distant vision. NCLEX board asks the question, for visual acuity, what chart you use? We use the Snell chart. The client is positioned in a well-fit distance within 20 feet from the chart, with the chart at eye level, and asked read the smallest line he or she can. So you ask the patient to read the smallest, like this one. If they can read. If they do not, then tell this line: D, E, F, P, O, T, E, and C. So if your patient can read it from 20 feet distance, we call 20/20 vision. So if the glasses are for the reading only, they are removed because they blur the distant vision. Or one eye, check at a time. Results are recorded during the fraction at the end of the last line. Successfully read to the chart. Normal visual acuity should be 20/20. Sometimes NCLEX board asks, what does it mean 20/20 vision? It means the distance in feet at which the client is standing from the chart, or distance in feet at which a normal eye could have read the particular line. Next, to check the near vision, test it using a handheld vision scanner that contain the various size of the print, or the client is asked to read from a magazine. And each eye tested separately with the client's glasses on or contact lens in. The normal result would be 14/14, means distance in inches at which the subject hold the card from the eye, or distance in inches at which the normal eye could have read that particular line. It is the normal vision. Here showing a test, and this is called confrontation test. What does it mean? So confrontation test used to measure peripheral vision. Also compare the client peripheral vision with examiners under the assumption that the examiner peripheral vision is normal. The client covers one eye and looks straight ahead. So you see the patient cover one eye. The examiner position is 2 feet away. Also cover his or her eye opposite the client's covered eye. The examiner advanced a finger or other small object input the periphery from several directions. The client should see the object at the same time the examiner does. Next one is called corneal light reflex. So used to check for parallel alignment of the axis of eye. The client is asked to straight ahead as the examiner hold a light about 12 inches from the client. The examiner also looks for reflection of the light on the corneas in accurately same spot each eye. So here a picture we see. So this is the pupil and this is the sclera and eyeball. So normal central location of corneal light reflects. So when the light is fall, light ray hit the center of fovea. It's called the center of the pupil. But in case of corneal light reflects displaced nasally, here you can see this normal location change towards the nasal side. Now, the eye, the six cardinal position of gaze, the six muscles that attach to the eyeball to its orbit and serve the direction of the eye points of interest are tested. So there are six muscles participate to complete movement of our eyes. Also, three nerves is innervated, like cranial number 3, 4, and 6. So client hold the head still and is asked to move the eyes and follow a small object. The examiner note any parallel movement of the eye or any nystagmus are involuntary or voluntary, rhythmic, rapid twitching of eyeball as well. So in this picture, we are see the three muscle is associated with the movement of eye, right? So they said movement of the eye or nystagmus and involuntary. So what is nystagmus? So it is an involuntary eye movement which may cause the eye to rapidly move from side to side or up or down or in circle or any slightly blur of vision. It is called nystagmus. Next, color vision. Test for color vision is involved the picking the number or letter out of a complex or colorful picture. This chart is called Ishihara chart. Ishihara chart is used for testing and consists the number composed of color dotted located within a circle of colored dot. The client is asked to read the number on the chart and each eye is tested separately. Reading the number correctly indicates the number of color vision. Also, test is sensitive for diagnosis of red and green blindness, but cannot detect discrimination of blue. The first slide on the Ishihara chart is one that everyone can discriminate. Failure to identify the number on this slide suggests a problem with performing the test, hmm, but not a problem with color vision. So this is the Ishihara chart. There are so many dotted and number, so we can read it. Like first one is 16, second one is 9, third one is 74, and last one is the 12, right? We ask the patient to read it. Now go for sclera and cornea. So this one is the sclera. So if this yellow color of the sclera may indicate jaundice. Jaundice is not a disease. It is the symptom of liver problem or hepatobiliary problems or systemic problems. In a dark skinned person, the sclera may normally appears the yellow. Sometimes some people have bilirubin is little bit high. It is not a clinical jaundice. And that times their sclera a little bit light yellow. And this is called Gilbert syndrome. So pigmented dot may present, or cornea should be transparent, smooth, shiny, and bright. And cloudy appearance or on the cornea may be result of accident or eye injuries. Here we can see ophthalmoscopy. As I told you, by ophthalmoscopy, we visualization the structure of eye. So here, the ophthalmoscopy is an instrument used to examine the external structure and interior of the eye. The room is darkened so that the pupil will dilate. The examiner inspects the size, color, and clarity of the sticks, also integrity of the vessels and appearance of macula or fova, and looks for any kind of retinal disorder. And what next? Re-educate the client teaching. So instruct the client to notify the healthcare provider if any alteration of the vision occur or any redness, any kind of swelling or drainage from the eye is noted. In this picture, it is the normal retina or normal ophthalmoscope we can see. But here showing diabetic retinopathy. So because of uncontrolled diabetes, some pathological change occur. And keep it note, if diabetic retinopathy is not untreated, can lead to blindness. And definitely, if we get any patient like this, we refer to ophthalmologist. Here showing the healthy person retina. This one is called optic nerves and macula. But here showing any patient who have diabetic retinopathy, same picture, hemorrhagic spot. Also the fluid leaking out of the blood vessels. This is hemorrhagic spot, hemorrhagic spot. Now go for ear. So when a patient have ear problem, Hmm? And here I want to tell something. This pupil, a common question and Flipboard asks, when pupil is dilated, we call mydriasis. So dilate the pupil, dilate the pupil occur if we give them atropine. So this is the pupil, and we call mydriasis. When the pupil is constrict, we call myotics. Constrict the pupil. The medication can cause like pilocarpine or acetazolamide. Now go for ear. If any patient come to us because of ear problem, so ear disorder. Ear disorder is important to check and remove the underlying cause for prevention of hearing loss. So in here we're going to talk some diagnostic test, purpose, description, and nursing implication. So here we are going physical examination, particularly like Romberg test, Weber test, Rini test, and also nursing management. So for some time, patient complain about subjective data because of disorder. So when a patient come, we have to check, we have to see, watch it, inspection, then palpate, hearing test because of hearing impairment. So also vestibular assessment and use of an otoscope. So this device is called otoscope. When hearing test, when we do it, hearing test is associated with aging. And also, sometimes patient use the hearing aid. Patient come to the doctor office for the hearing test because of aging or hearing, if they use the hearing aid when not in use the store in a clear, or like hearing aid doesn't work, they come to check it. Or some disease like Meniere's syndrome, right? Patient present with the vertigo, tinnitus, or hearing loss. What are the other signs symptoms? Difficulties of hearing, sometimes earache, drainage from ear, dizziness, ringing in the ear, exposure to the environment noise, use of hearing aid, medication being taken, history of ear problem or infection. After you examine your patient, what we can see, we call subjective data, like inspect and palpate the external ear, or notice the size, shape, symmetry, skin color, and also presence of pain. Inspect the external auditory meatus for size, for swelling, redness, discharge, and foreign bodies, if any. Sometimes accumulate the cerumen, means ear wax, maybe need to remove. Here we're showing different tests. It's called auditory assessment, conductive hearing loss, sensory neural hearing loss, and a mixed means conductive and sensory both together. For the auditory assessment, sound is transmitted by air conduction and bony conduction. So like the picture, when you put the tuning fork in the vertex, means sound is transmitted through the bones, which is called bony conduction. When you put the tuning fork in front of ear, sound is transmitted through the ear. We call ear conduction. Ear conduction takes 2 or 3 times longer than the bony conduction. Hearing loss is categorized as a conductive or sensory neural or mixed conductive and sensory neural. Conductive hearing loss is caused by any physical obstruction to the transmission of sound wave. And sensory neural hearing loss is caused by a defect in cochlea or 8 cranial nerves or the brain. The mixed conductive and sensory neural hearing loss result in profound hearing loss. So now another test called audiometric testing provide a precise quantitative measure of hearing by assessing the client's ability to hear sound of various frequencies. Now go for voice test. Voice test used to determine whether hearing loss has occurred or not. One ear is tested at a time, and the ear not being tested is occluded by the client. The examiner stand 1 to 2 feet from the client and cover his or her mouth so that the client cannot read the lips or also exhale fully, and softly whisper 2 syllabi word in direction of the unoccluded ear. The client points a finger up, and during the test, when examined voice is heard. NCLEX board frequently asks the question about the Weber test and Rini test and Rombach test. The first one is Weber test. So in this picture, please, this is called this one is called turning fork or tuning fork. This turning fork on the top of the head, you see in the first picture, but this one is Weber test. But in Rini test, here, number B and C, place the tuning fork on the masseter bone, like picture number B. The bones behind of the ear or auricle is called masseter bones. We place up there or near the front of ear. And the client should report that the sound is louder near the ear as ear conduction is greater than bony conduction. Let me read it. Testing hearing with a tuning fork, both for the both test, hold the tuning fork as it base with one hand and then strike it again your opposite palm so it vibrate. After vibrate, the base we placed in the vertex. So perform a Weber test that place the base of the tuning fork on the center of the top of patient head, we call vertex area, and ask the patient where sound is heard the best. Hmm? And then go picture number B and C, performing the Rini test. First, place the tuning fork base of mastered process. So this is the ear behind of the ear, mastered process. Ask the patient when the sound can no longer be heard. And then picture number C, then immediately move the two uniform hand in front of external auditory canal, this one, and ask the patient if can hear the sound. The normal ear will do so. As I told you, Rini test, when place the tuning fork on the mastoid bones and near the ear, the client should report that the sound is louder near the ear as ear conduction is greater than the bony conduction in case of Rini test. Then next, little bit more explanation. Let me read it. Webner test. Stem of vibration, the tuning fork is placed in the midline of the client's skull, and then the client is asked if the tone sound then same in the both ear or better in one ear. The client hears the tone by bone conduction, and the sound should be heard equally in both ears. Then Rini test. Stem of vibrating tuning fork is placed on the client mastered process. When the client no longer hears sound, the tuning fork is quickly inverted and placed near the ear canal, and the client should still hear a sound. Normally, the sound is heard twice as long by way of ear conduction than the way of bony conduction, means mastoid. So here we see the ear examination, the first picture. This is the otoscope, and this is the inner ear, and three bones in here. Easy way to remember: MIS, meniscus, incus, and stapes. And the tympanic membrane is there. The normal tympanic membrane look like this picture. If the tympanic membrane is tear or perforation, we can see it like this. And this is otoscope, and the examiner can see the client ear inside. Otoscopic exam. An otoscope is used for the best visualization. The largest speculum that fits comfortably into the client ear canal and should be used. The examiner asked the client or tilt the head slightly away to the opposite shoulder, and next the nurse pull the pinna up and back and hold the otoscope upright down and insert the specula slightly down and forward and approximately half an inch into the ear canal, this one. And before performing an otoscope exam and inserting the specula, the examiner neck the auditory canal for any kind of foreign bodies. The canal is instructed, the client is instructed not to move the head during the examination avoid the drainage to the canal and tympanic membrane. Now, let me focus on education the client teaching. Instruct the client to notify healthcare provider if any alteration in hearing or ear pain or ringing the ear occur, or any kind of redness, swelling, or drainage from ear should be noted. Instruct the client in the proper method of cleaning the ear canal. The client should cleanse the ear canal with corner of a washcloth or should never insert sharp object or right to avoid the rupture of tympanic membrane. NCLEX board sometimes asks a question during the eardrop administration for adult and child. What we should do during the adult, always pull the ear back and up for the adult, and during the child, pull the ear back down for a child under the age 3 years. Easy way to remember. Adult, A-D-U-L-T. U means for up. Pull the ear back and up for adult. Child, C-H-I-L-D. D for down. When patient need to put the eardrops, pull the ear back and down for the child. Next, let me talk about the nose, mouth, and throat. In this picture, we can see some of the sinuses. This is the bones. These bones contain the ear. Because of these bones and because of this bone content ear, our head is lighter. This is called frontal sinus. This one is called ethmoidal sinus, maxillary sinus. And this one, nasal septum. When patient have any problem in the nose or mouth or throat, the common objective data or sign and symptom, external nose should be, okay, first of all, let me tell you what are the normal. External nose should be midline and in proportion of the other face feature. It should be symmetrical, center or midline. The patency of the nostril can be tested by pushing each nasal cavity and closed and asking the client to sniff inward through the other nostril. The examiner used a nasal specula on also light, pin light, or a short and wide trap speculum attached to an otoscopic head. So the examiner used a nasal specula and pin light or a short, wide trap speculum attached to the otoscopic head to inspect for redness, swelling, any kind of discharge, or epistaxis or bleeding, or even foreign bodies. The nasal specula is checked for any kind of deviation. Now, examine the process for frontal sinus and over the maxillary sinus. This is called maxillary sinus. Or the client should feel the firm pressure, but no pain. Here we can see the first one is palpate the nose, second picture, palpating the sinuses, and third one, percussion the sinuses. Here we see same picture but different way. Sinuses, frontal, ethmoid sinus, maxillary sinuses, right? And sometimes if in case of sinusitis, this sinus should be full with pus and or mucus, patient present with the pain, dull aching pain. What are the objective data? So the external and inner surface of the tip are checked for color, moisture, crackings, or any kind of disorder. Also, the denture are inspected for condition and number, or it should be white or straight and clear. The alignment of the upper and lower jaw is checked by having the client bite down. Also, we inspect the gum or any kind of swelling, bleeding, discolor, or retraction of the gingival margin. So this picture, we can see when we examine the inside the mouth, we have to try to see the gum. We should try to check the jaw, right? And also we see any kind of pathologies inside the oral cavities. A tongue is inspected for color, surface characteristics. So the small granules look like over the tongue, right? It is normal. But if the patient have any disorder, the granules will look like smooth, we call beefy tongue. Example like vitamin B12 deficiency, or sometimes the tongue is blackish. It is the disorder. Or moistureness, any white patch, nodules, any ulceration, or dorsal surface is normally rough, and also ventral surface smooth with visible veins. Examine the retract the cheek with the tongue depressor to check the buccal mucosa and check the color, and also for presence of any kind of nodules. Normal mucosa inside mouth should be pink, soft, moist, and smooth. Also we could use using the pin light and tongue depressor. Also examine the inspect for hard or soft palate for color, shape, texture, any kind of defect. The hard palate up there. Hard palate means roof of the mouth, and which is located anteriorly or should be white or dome shaped. The soft palate, which extend posteriorly, and should be light pink and smooth. And pharyngeal reflex can also be tested. We called gag reflex. A question and would ask, if a patient any kind of surgery and any kind of under general anesthesia, when we give them food, we will give them food when patient has a gag reflex return back. Next, the uvula. So this one, the last portion of the mouth or oral cavity is called uvula, is inspected for midline location. Examine, ask the client to say or also watch for the soft palate or uvula to raise the midline. using a pen light. So this clinician use a pen light, and this is the tongue depressor. So the examiner inspect the throat for color, presence of tonsil or not, presence of exudate. Also check the cranial nerves, 12 cranial nerves, what is associated with chest, which is called hypoglossal nerve, asking the client to stick out the tongue, should protrude in the midline. So what are the education? If patient have any nose, mouth, or throat disorder, so emphasized the importance of oral hygiene and also dental care, as well as regular dental checkup and use of fluorinated water or fluoride supplement, because fluoride is good for our denture. We encouraging the client to avoid at the risk behavior. What are the risk behavior? Like smoking or alcohol consumption, or how to manage the stress. Stress is also important to reporting the pain or abnormal occurrence like nodules, sign of infection,